Dr. Moira Wong, a consultant trained orthodontist, and quite often I will have adult patients coming to see me who present with a multitude of different things going on in their mouth. Quite often the first thing they notice is that their teeth have been moving as adults, and once as a child they had perfectly straight teeth, and they've noticed over the last 10-15 years that these teeth are migrating. And normally in the beginning they don't really notice it too much, but it gets to a point where they're spotted at a birthday party or at a wedding, and someone will say, "Oh my goodness, is that my picture? And the teeth look awful." And so they come in and they say, "Dr. Wong, can you sort these teeth out?" And in adults it's not always that straightforward. I examine the patient and I find that they actually have signs of gum disease, which means that I can't immediately treat them in that instance. And in that case, I would refer the patient to my colleague, Dr. Rocchietta here, who would see the patient for an examination and diagnosis. And
yes, because my name is Isabella and I'm a periodontist, and it's true, a lot of patients do present with gum disease, and gum disease is almost seen by the patient as something threatening, and a lot of patients tell me, "Oh, my dentist said it cannot be solved, it cannot be cured, there's nothing to do about it." And usually you notice this because your gums bleed when you brush your teeth, or even spontaneously, but in fact it is very common and it can be treated very successfully, and every case has to be first extremely healthy in terms of gums before doing the tooth movement, and that's where I would refer back to Dr. Wong so that she can then fix it in the right position.
yes, and once the patient comes back and the gum disease has been treated, we're often as successful as we are with children in achieving that beautiful smile that they've always wanted.